Good afternoon. My name is AWelch, and I'm here today to talk to you about a subject that has been debated for years. It's a subject that's going to question your moral beliefs about your right to live and your right to die. I've personally debated this subject on both the positive and negative side for the past 5 years. I'm here today to talk to you about a person's right to die with dignity, their right to have their physician help them end their suffering, their right to commit physician-assisted suicide. Before we get into the heart of this much debated subject, I want to be clear on what physician-assisted suicide really means. Physician-assisted suicide happens when a physician provides either equipment or medication or informs the patient of the most efficient use of already available means for the purpose of assisting the patient to end his or her own life. This is not to be confused with euthanasia, where the physician administers the treatment or medication themselves. Today we're going to cover the immediate benefits of physician-assisted suicide, the differences between a do not resuscitate order, removal of life support, and physician-assisted suicide, and the legal structure that can be constructed to mitigate the abuse of the system. I want you all to imagine what it would be like knowing you had 6 months left to live due to a terminal illness. 6 months of agony. The excruciating pain you're feeling now is only going to get worse. Your family would slowly see you lose control of your muscles, your bowels, and your independence. They would be left with the image of you as a former shell of yourself, not how you want to be remembered, full of life and whole. Now let's be clear that that situation could have been avoided through the means of physician-assisted suicide. The patient could have avoided the slow, painful death that awaited them. They could have had the opportunity to say goodbye to their family when they weren't suffering and when they weren't in pain. Decision could have been made as a unit, knowing that this is what the patient wants. Those left behind could have the peace of mind knowing their loved one died in peace and be there when they did so, not leaving them alone or unattended. The patient, through organ donation, could also potentially be able to save another life while ending their own pain. The patient's right to make decisions regarding their own life is something we currently only extend to the healthy. A DNR order, or do not resuscitate order, the definition is as follows. The Cancer Institute says a DNR order is a type of advance directive in which a person states that healthcare providers should not perform cardiopulmonary resuscitation, restarting the heart, if his or her heart or breathing stops. This order is very similar to a living will regarding life support. You can choose to not be put on life support, and your family can choose to take you off of it. You can choose to refuse life-saving treatment, just as you can choose to receive it. You should be able to choose to end your suffering. We allow the healthy to make decisions regarding their own mortality. Why can't we let the dying do the same? In the United States, there are currently 3 states that allow some form of physician-assisted suicide: Oregon, Montana, and Washington. These states have established procedure in order to keep the abuse of the system to a minimum. For example, Oregon's Death with Dignity Act passed in November of 1994, but not in effect until 1998, allows a patient who has been diagnosed with a terminal illness with less than 6 months to live to acquire a prescription from their physician for a lethal dose of medication. This medication must be self-administered and cannot be administered by a friend, family member, nurse, or physician. In Section 2 of the Death with Dignity Act statute, the safeguards are outlined. Some of these include there must be 2 witnesses present at the time of the request of medication, and the request must be made twice, the first in writing and the second orally 15 days later. There must be 2 witnesses present at the time of the request. One of these witnesses cannot be the physician, a family member or relative, stand to benefit from the patient's estate, or be an owner or operator where the patient is receiving treatment. Also, the diagnosis has to be confirmed by another physician, and if there are any doubts to the patient's mental health, a psychologist will be called in. According to an annual report from the Oregon's Death with Dignity Act, 401 patients have chosen to invoke their right to die with dignity since 1994. The median age of those dying was 70, with 95.1% dying without complication. 81.8% of that 401 were dying due to some form of cancer, 94% included their family in their decision, and 94% of them died at home surrounded by their loved ones. As you can see, physician-assisted suicide will allow the terminally ill to die with dignity. The patient and their families will not have to endure months of suffering. It will give those that are dying power over their lives, and with the proper structure mandating procedure, abuses of the system will be few. Ladies and gentlemen, to quote Jack Kevorkian, a right to die activist, dying is not a crime. Thank you.